Doty. Now he's talking shoulders and what happens when an athlete's shoulders are injured.
Yeah, we often hear about a break or dislocation, but what do those terms really mean? The Spectrum Health Medical Group orthopedic team explains.
Football players get hit and hit hard. Think of a quarterback getting drilled while throwing a pass. That's a recipe for a dislocated shoulder, something Dr. James Lebolt of Spectrum Health Medical Group sees a lot this time of year. And he says protocol has changed as far as what needs to happen on the sidelines.
The dogma was we could put these back in place, get kids back in the game. Now we know better. We know the damage occurs every time this shoulder comes out of socket. It's a cheese grater effect on the ball itself against the socket, and it actually will start to wear off cartilage. And whenever you lose cartilage, that forms an arthritic condition.
A QB can also get sore from throwing too much, though that's more of an issue for a baseball pitcher.
They don't generate the torque that baseball players do, okay? So the elbow leads a little bit more, the arm leads a little bit more. And what I mean by that, baseball players tend to have their elbow back here and their hand behind them. With football players, it's a little different mechanic and a little different torque on the arm, so they don't have quite the stress.
Dr. Lebolt says softball pitchers really put a lot of strain on their shoulders too, even though we've been led to believe that motion is not stressful. Then there's volleyball, where athletes are coming over the top with vicious force over and over.
You can have rotator cuff tear issues, which is the tendon that comes across the top of the shoulder. As the shoulder rotates, it can rub. You can also get a problem with the gasket in the shoulder, which deepens the socket, holds the ball in place, but with that repetitive external rotation of the shoulder, that will tend to wear and tear and can cause pain with overhead activities.
It may seem like the type of problem a veteran athlete will have, but Dr. Lebolt says things like this are now the norm for kids who are just doing too much, too often.
And these kids are actually seeing more revolutions in their shoulder before age 18 than people that have, particularly baseball players who have completed their major league careers, when we even look back 10 years ago, have done.
Tim Doty, Fox 17 News.
And shoulders being one of those things. If you don't
gosh.
fully get it healed, it's going to